Hi Samuel, I'll be your physical therapist today. My name is Levi. So tell me about your knee pain. What's going on?
It just hurts when I play basketball mostly. Like when I start playing it just is really sharp pain.
Okay. So how long ago did this start? Was this recently?
Yeah, pretty recent.
Okay. And was there like a specific event that happened where you running and twisted your leg and it started hurting, or something else?
No, I think it's just gotten worse over time.
Okay. And just kind of nothing specifically caused it to start hurting? No popping?
I can't think
or
of
anything?
anything.
Okay, great. Can you show me where your pain is?
Yeah, it's like right here in this knee.
Right there. And is it just kind of very specific, right that spot, or is there any like pain any other areas in your knee or leg?
Just right there.
Okay. Any numbness or tingling? Okay. Do you have any? So let's just talk about some other like random, seemingly unrelated symptoms. Do you wake up in the middle of the night having to pee more regularly than normal, or have difficulty starting or stopping peeing?
No.
Do you have you noticed any change in weight or height even recently?
No, I've been the same weight and height for a while.
Okay. I see you're on some high blood pressure medication. Has there been any changes to your heart health recently that you've noticed?
No.
Okay, great. So on a scale of 1 to 10, what's the best your knee feels and what's the worst it feels?
Like when I'm just sitting around, it doesn't hurt at all. The worst is, I don't know, I got like a 5.
Okay, and when does that happen?
Usually like when I first start playing.
Okay. Does it, so you start playing basketball, you get on the court, get to practice, and you start playing and it gets really bad. That's like a 5 out of 10. And then does it get better as you play, or get worse or stay the same?
It keeps hurting, but it like gets a lot more mild.
Okay.
Yeah.
And then when you stop playing, how about that? Does it hurt more?
No, it goes away.
Okay. Then it'll kind of gradually go away after you stop playing?
Yeah.
Okay. But it's the worst immediately when you start playing. It kind of calms down after that.
Mm-hmm.
Okay, great. What other things hurt? Squatting. I see you said squatting on your intake form, but then it looked like generally most of the other activities, most of the things that you have to do are pretty mild. Just getting dressed, getting in bed, all of those things just kind of seem pretty normal. Okay, great. Is there any catching in your knee when you stretch or flex, or
like you can't move it?
Does it feel like you can't move it, or like there's a spot that stops, or is there any popping, clicking noises or grinding feelings?
No. Okay,
great. So this seems pretty classic. You're a basketball player. You work really hard. Your recent games, you had lots of overtime. So you've just been working extra hard. So we're going to do a couple tests just to make sure that we know exactly what's going on. I'm going to move your knee around. I'm going to poke it. I might cause some pain. We're going to do some just general movement. I'm going to have you squat. I'm going to do some of the things that kind of hurt. And we're going to just see if we can recreate the pain that you feel when you start playing basketball.
Okay.
And then at that point, we'll be able to really narrow it down to what's really going on. And then we'll be able to start treating you and get you feeling better so you can get back on the court.
Okay.
So first, what I want you to do is just stand here, and I want you to just see you just do a squat. I just want to see you move.
Okay.
Any pain there?
Yeah, like right at first, yeah.
And is it that same, so go ahead and do a squat and then point to where it hurts.
Like right here.
Right there. And it's not, is it deep at all, or is it just that one spot?
Fine.
Just that one spot?
It's just that one spot.
Okay, perfect. Then I want to just look side by side and see your knees look like they're the same width generally. No, I don't see any major swelling. So go ahead and just lay down on the ground, toes that way. And we're gonna do some tests. So just go ahead and relax your leg. I'm gonna move it around a bunch. So first I'm gonna just poke it. Does this hurt right here?
Mm-hmm.
Okay, what about over here?
No, it doesn't hurt.
Okay, so I'm gonna move this and just keep relaxed. Any pain when I push your patella around this little bone right here?
No.
About right there.
Yeah.
Okay. So now I'm gonna just hold this. Actually, let's go. Let's just rule out. So I'm gonna go all the way up. Here. Any pain there?
No.
Okay, good. Now the opposite. Any pain there?
No.
Okay, great. Then just flatten your knee, and I'm gonna push down here, right over what's called your patella, this bone right here, and go ahead and just tighten this muscle. Perfect. Any pain there? Great. So push there, and no pain there. Now let's just go right into, so we know that it hurts right here. So I'm gonna push onto here. Just keep your leg relaxed, and this hurts, right?
Mm-hmm.
Okay. Let me know how your pain feels. You getting any better, any worse?
It was the worst down there, and it's better up here.
Okay, great. And then any tenderness over here? Oh, what about back here? No tenderness? Perfect. And then let's go ahead and last thing that I'm going to have you do is just we'll go ahead and stand up and then slowly lower yourself down. Let me know how that feels. And I'll just put that over here and have you face me. Just with your...
That hurts.
That hurts. Okay, go ahead and stop. Perfect. So that's, I don't feel the need, go ahead and sit down. So I don't feel the need to do any neuro screening. I don't think it's a nerve problem, which is great. I think it's basically just this tendon right here on the front of your knee. It's put under a lot of stress, especially as you're jumping and running and squatting down. A lot of the things that you have to do during basketball just put a lot of strain on that, especially as you're laying. And so sometimes if you significantly increase how much you're doing, like for example, when you have a bunch of overtime, then sometimes that just puts more stress on that tendon than what your body's used to. And so right now it's just a little bit angry with you, and so it's just gonna kind of every time you start working, it's like I need some rest. So basically what we're gonna do is we're gonna help calm down the area that hurts, and then we're just gonna strengthen it back up so that it can be used to greater loads than what you're stressing your body to do. So it's just what we call jumper's knee. It's a pretty easy thing to fix. So we're just gonna calm it down and then strengthen it back up so that it can handle all the stress that you're doing, so that you can get back to your summer basketball in a couple months.
Okay.
So how does that sound?
Yeah.
Do you have any questions for me? Great. So we're gonna go ahead and start with just ice, get feeling better, and then we're gonna just do some get on the bike and just slowly just warm up your legs again, and we'll continue with our treatment there.
Okay.
All right. Thanks, Sam.